First, use the loop electrode to incise a circle in the mucosa surrounding the colliculus seminalis so as to mark it. Make a resection around the 12 o'clock position with the loop electrode. Resect the 5 and 7 o'clock positions from the bladder neck to the surgically exposed area. Use the tube electrode to start enucleation from the median lobe, and then make an enucleation nearby the bladder neck. Enucleate the left and right lobes and recover the enucleated adenoma to complete the operation. Volume was 103 milliliters and TZ was 70 milliliters. First, using arc discharge generated by the loop electrode, make a surgical capsule exposure around the proximal side of the colliculus seminalis. Then, cut a circle from this exposure point in the mucosa at the distal end of the adenoma, so as to mark it. To avoid damaging the adenoma, take care to make the transpiration and incision on the mucosa only. Make sure to incise the mucosa around the 12 o'clock position. This seems to prevent urinary incontinence, which is frequently observed at the early stage of development of HOLEP. The fiber tissue lying between the 11 and 1 o'clock positions is sometimes difficult to enucleate. To simplify the operation, make a resection in this region with the loop electrode prior to starting enucleation. This makes it easier, for example, to match the layers enucleated from the left and right lobes. To divide the adenoma into 3 blocks, use the loop electrode to make longitudinal resections at the 5 and 7 o'clock positions from the bladder neck to the surgically exposed mucosa. Forcibly resecting to the surgical capsule may cause damage, so enucleate the adenoma first and then resect it. Use the tube electrode to start enucleation from the median lobe. Apply the tip of the spatula slowly to make blunt and longitudinal dissection of the area lying from the surgically exposed area to nearby the bladder neck. The spatula can also be used as a retractor, helping to keep the visibility of the operation field. Furthermore, the loop consistently coagulates and stops bleeding from blood vessels to maintain the surgical site clearly visible. At the bladder neck, rotate the endoscope by 90 degrees to make horizontal dissection along the internal urethral orifice. Do not continue longitudinal dissection to this point, otherwise the dorsal side of the bladder neck may be damaged, particularly in patients with severe hyperplasia of the median lobe. The use of arc discharged from the tube electrode would make removal of the remaining mucosa easy. After completing the enucleation of the median lobe, enucleate the left lobe once again from nearby the colliculus seminalis with the tube electrode. Up to the 3 o'clock position, mainly use the longitudinal strokes of the handle to dissect the lobe. Then you can dissect the abdominal side lobe using the circular movement of the endoscope with the entire spatula pressed onto the target layer. If this layer does not match the first resection made in the 12 o'clock position, press the tube electrode onto the layer so as to cut it little by little until those layers match. Otherwise, it may be resected using the loop electrode. After the enucleation of the left lobe, enucleate the right lobe in the same way. During the enucleation, make sure to coagulate and stop bleeding to maintain the surgical site clearly visible. For reliable blood coagulation, the tube electrode should securely contact the target tissue for a bit longer time than the conventional monopolar technique. Incising the mucosa nearby the bladder neck is much easier with the tube electrode than with the holmium laser device. In the same way as that for the left lobe, make small incisions in the fiber tissue using arc discharge to match the enucleated layers. Leave the enucleated adenoma in the bladder in the same way as those for the median and left lobes. With this system, you can easily trim an apex and a neck using the loop of the tube electrode, or the loop electrode. Also, reliable blood coagulation to stop bleeding is possible. shape and size of adenoma.